Hi, hello everyone. Welcome to Farre Series and welcome to the lecture of FMT Practicals Overview. So, we discussed around 6 classes in detail about Farre Series, like important long essays, important short essays and important short answers that can be asked in your prof exam. And this is the last class of the Farre Series, FMT Practicals Overview. So, am I audible? Am I audible? Audio video, is it clear? Can anyone reply me? Yes. FMT practicals, it differs from one university to other university. Uh, some they ask around 80 marks exercise in some universities. In some universities 40 mark. So, depending upon university actually. Okay. Okay. So, FMT practicals, the blueprint of FMT practicals, that is OSP in FMT. OSP, as you know, objective structured practical examination. So, what is the blueprint and what are the commonly asked exercises? The one very commonly asked exercise is your wound certificate. Okay, wound certificate around 10 mark. So, around 10 mark. So, you must know the proper writing of the wound certificate. In some universities, they give the clinical scenario or they will provide you some photographs. So, you need to write about the wound certificate. The very important is the examination of the injuries and also about the opinion. So, you need to mention in wound certificate whether injuries are simple or grievous. Simple or grievous. Okay. Anybody? So, what is the BNS section which defines grievous hurt? What is the section of Bharatiya Nyaya Samhita that defines grievous hurt? So, in exam, you must know about grievous hurt in detail and all the 8 clauses of grievous hurt. The emasculation, permanent privation of sight of either eye, permanent privation of sight of either ear. So, you must know in detail about grievous hurt to just to pass in the practical exam. Yes, Sumana De, yes, very good. It is 116 BNS. So, we discussed in detail about grievous hurt in the Farre series. So, you must know. So, you need to mention whether injuries are simple or grievous. Then also about the age of the injuries. Age of the injuries, whether they are fresh or 2 days old, 3 days old. So, depending upon the color changes, especially in abrasion and the bruises. And also need to mention about the weapon that is used. Weapon used in the particular injury. Weapon used. So, anybody, what are the injuries caused by blunt weapon? So, what are the injuries caused by blunt weapon? Sumana Ade and others. Anyone? What are the injuries caused by blunt weapon? Can anyone answer? So, I will repeat again, wound certificate can be a 10 mark exercise in your exam. So, the very important is the explanation of the injuries or description of the injury, whether abrasion, bruise, contusion, laceration, stab wound, incised wound. And in the opinion, what you must write, either whether it is simple or grievous. Again, it depends on the 116 BNS. If it comes under any section of grievous hurt, then it is grievous hurt only. So, grievous hurt is a punishable offence, simple also punishable. Age of injuries depending upon the color changes. If abrasion reddish in color, then it must be fresh in nature. Bruise reddish in color, it must be fresh in nature. And the weapon used, weapon can be blunt weapon or it can be sharp weapon. The blunt weapon, what are the injuries? Yes, very good, Sumana De, Deepika Das. Abrasion, laceration, contusion. Excellent answer, Deepika Das. So, weapon, the blunt weapon, what are the blunt weapon injuries? They are basically abrasion, bruise and laceration. So, laceration has irregular margin, incised wound has regular margin. So, this is what the funda behind wound certificate. The very important is the opinion and the description of the injury. Rest all you can write history, preliminary details, date of examination, everything you can write. You can go through the pro forma we discussed in PW classes as well. Okay. Yes. So, this is the first exercise very commonly asked. Second exercise is your age certificate. So, age certificate it can be 15 marks. Okay. 15 mark. 15 mark. Why? Because age certificate it is lengthy. You need to write about general physical examination, dental examination, X-ray findings or the ossification center and also the final opinion. So, age certificate usually 15 marks. So, again age depending upon the general physical examination, radiological examination, that is nothing but X-ray findings, dental examination, then final opinion, then the final opinion. Okay, final opinion. Anyone? What is the age of fusion of radius? What is the age of fusion of lower end of radius? Can anyone answer? The lower end of radius fuses with the epiphysis, it becomes a single bone. So, what is the age of fusion of lower end of radius? Can anyone answer? Yes. So, A certificate you need to write about the general physical examination and the opinion, radiological finding and the opinion, dental examination and the opinion, and the finally collective opinion at the end, that is the final opinion, usually 15 mark. Yes, anybody? Anyone? Lower end of radius? Come on guys, lower end of radius, when it fuses? Very good, 18 years. Sumana De, excellent answer Sumana De. She answers her 18 years. So, lower end of radius and lower end of ulna usually 18 years. Okay. So, you must know the when it appears, when it fuses. Okay. Carpal bones are very commonly asked. So, capitate, hamate, triquetral, scaphoid and all. Elbow also can be given. So, and dental examination about the molar appearance, all this. Okay, 18 to 19 years. So, again age certificate we discussed in PW classes, we can go through that. Okay. Now, skeletal remains. Okay, next important is skeletal remains. So, again it is a compulsory exercise, skeletal remains. The skeletal remains is around 10 mark. Okay, 10 mark. So, in some universities they give probably a set of bones or a single bone. You need to write about the final opinion. So, you need to concentrate on 4 important criteria. 4 important criteria are the parameters. Parameters you need to concentrate while skeletal examination. The first thing is the age of the bone. Second, gender, that is male or female. Third, that is the race. Last one is the stature. Okay, stature. So, they are known as 4 important markers or 4 important components of skeletal remains. So, age, sex, race and the stature. So, you need to write about these findings, and sometimes they can ask you whether it is of human origin or animal origin. So, that is based on the precipitating test, whether bone or not. So, okay, whether bone or not, human or animal origin, if human, how it is. So, what is the age of the skeletal remain, probable age, male or female, race, stature and all, very commonly asked. So, after that you need to give the report. Okay. Yes, so this is about the skeletal remains. So, any one say example, humerus is given. So, humerus is given and length of the humerus is 30 centimeter. So, length of the humerus is 30 centimeter. What would be the stature? Anyone, can you guess? During skeletal examination, length of the humerus is 30 centimeter. What would be the probable height of the victim or the person? Anyone? Anyone? Come on, guys, come on. Yes. Yes, yes, come on. Sumana De, Deepika Das, can answer this question? Okay, so three important exercise. Okay, multiplication factor is 5.3, 5.3 into 30. You multiply, it becomes around 159 centimeter. I know 159 or 160 centimeter. So, good. So, multiplication factor is 5.3, it becomes 160 probably, right. So, wound certificate, age certificate, skeletal remains, so 10 mark. So, have you understood? Okay, three important certificate. Yes, guys, yes or no? Just say yes or no. Till this point, have you understood? Wound certificate, age, and skeletal remains. Say yes or no in the chat box. Chalo, next comes is victim of rape. Okay, victim of rape or accused of rape or drunkenness certificate. Okay, the fourth certificate is the victim of rape. So, either it can be victim of rape or sometime they can ask about accused of rape or drunkenness certificate. Drunkenness certificate. So, any of these three can be a 10 mark exercise. Okay. Yes, fine. So, victim examination we discussed in detail in PW classes, you can go through that. Accused of rape also we discussed in detail in Shushrata batch, you can go through that. Drunkenness certificate also very simple one. So, you need to go through that. Okay, this certificate one can be asked. Then PM certificate, postmortem certificate. So, in postmortem certificate, they usually provide a clinical scenario. So, a case of alleged history of suicide during examination, there is a ligature mark around the neck. The ligature mark is oblique in nature, dry hard parchmentization is present, no other injuries on the body, dribbling of saliva present. So, you need to write the PM certificate. You need to properly write all the important findings, and you need to frame the PM certificate along with the opinion. Okay. So, PM certificate usually it can be a case of hanging or case of strangulation or a case of poisoning. So, or case of road traffic accident, anything that can be asked in your exam. PM certificate. Anyone, what is the cause of death in case of hanging? What is the cause of death in case of hanging, guys? Say example, hanging is given. Hanging clinical scenario is given. So, what is the cause of death you are going to mention? Or drowning can be given. Drowning, strangulation, okay. So, what is the cause of death in case of hanging, guys? Yes, very good, Deepika Das, it is the asphyxia, very good. So, it is the asphyxia is the cause of death, very good point, asphyxia, right. So, asphyxia is the common cause of death in case of hanging, in case of drowning, in case of strangulation as well. So, PM certificate usually 10 mark. So, the next comes is your spotters, okay, spotters. So, around 10 mark, okay, around 10 mark. So, carry 1 mark for each spotter, 10 spotters in the exam. So, we are discussing in detail about spotters in today's class, okay. Okay. Then comes is your MCCD. MCCD, medical certification of cause of death, one compulsory exercise in your exam. So, as a medical student, as a doctor, as an intern, you must know how to write correct MCCD. Okay. So, MCCD can be 10 mark. In some university it is of 5 mark also as well. So, again the very commonly asked is what is 1A, what is 1B and what is 1C and what is 2, very commonly asked. So, in MCCD, what is 1A, what is 1B and what is 1C. So, as you know, 1A, that is the immediate cause, 1B, that is antecedent cause, then 1C, main underlying cause, the 2 is contributory cause, So, 1 very commonly asked, 1A, 1B, 1C and 2, that is contributory. Okay, MCCD, one very important exercise. So, we discussed this in PW YouTube channel also, as well as in the PW classes as well. You can go through that. So, 7 exercise. Yes, okay, 7 exercise, fine. Okay. Then last exercise. So, that can be preservation of evidentiary material in case of poisoning. So, 5 mark question. So, what are the viscera to be collected in case of poisoning? Say example OP poisoning. So, that can be 5 mark. Or some university they ask about preservation of DNA materials for analysis. So, what are the materials which are preserved for DNA analysis? So, that is also 5 marks question. Anyone? Say example poisoning. So, poisoning. So, what are the viscera to be preserved? Anybody? What are the viscera to be preserved in case of poisoning? There are 5 bottles, right? So, we discussed in our classes. In case of any case of poisoning, we preserve 5 bottles of viscera. Bottle number 1, bottle number 2, bottle number 3, 4 and 5. You also must know about the labeling, how to do labeling of these viscera. So, anyone, what is that bottle number 1 that consists of, 2 that consists of, 3 that consists of, 4 and also the 5. Anyone, can you answer? Anyone? Bottle 1 is stomach, okay. So, what is bottle 1? Basically stomach and duodenum, duodenum and its content, okay. Bottle number 2, liver along with the gallbladder, along with that kidney is preserved. The bottle number 3, that is blood. The bottle number 4, that is urine. Anybody, what is bottle number 5? What is bottle number 5 in viscera preservation? Anyone, can you answer? Anyone? Sumana De, Deepika Das. What is that present in bottle number 5 of organ preservation or preservation of viscera in case of poisoning? Like example OP poisoning, opium poisoning, cyanide poisoning, I know. What is that is present in bottle number 5? Not liver, it is not stomach. What is that? Anyone? Anyone, guys? Anyone? It is the preservative. So, remember, it is the preservative. Preservative it is, okay. So, this is the FMT practical. So there are 8 exercises in your exam. So I'll repeat again: wound certificate, A certificate, skeletal remains, victim of rape or accused of rape, drunkenness certificate, PM certificate, spotters, MCCD, finally the viscera in case of poisoning, or preservation of DNA materials for analysis. So this is how we conduct practicals in forensic medicine and toxicology. Okay. Yes. So have you understood the blueprint? Say yes or no in the chat box. So let's start about the spotters. So let's discuss some 10 spotters. So rest all we discussed in PW classes as well as YouTube channel. You can go through that. Okay, fine, understood, right? Yeah. So total mark is 80 marks, and plus 20 mark Viva, 20 mark, that is basically for Viva. So Viva, so it is 100 mark paper, right? Totally it is 100. So forensic practical 100, forensic theory examination 100. You need to get 50% in practical and theory, or in average you should get 50%. Okay. So this is the blueprint. Then comes is the spotters in forensic medicine. So spotters usually can be hair sample, seminal sample, other biological fluid, blood sample, photograph, poisons, histopathology slide, or it can be firearm cartridge, it can be weapon. So anything that can be asked in your exam from this. So it's all given in NMC guidelines. The spotter should be selected from these only. So either hair sample, blood sample, seminal sample, poison, histopathology, firearm cartridge, weapon, photograph, and specimen. Okay. So let's start with the spotter number 1. Anybody, what is the spotter that is visible on the slide, and what is the medico legal importance of that? Anyone? So they can give you this kind of spotter in forensic examination. So they can ask you identify below spotter what is the medico legal importance of this. So this is what question asked in your exam. Yes, good. Hair sample, very good. So this is the hair sample. Hair sample. Hair sample. So hair can be animal hair, or it can be human hair, right? Human hair. So remember the funda, medulla is very thick. Hair also has cortex and medulla. The medulla is very thick in case of animal hair, and very thin in case of human hair. So if the histopathology or microscopy that finding is given, if medulla is very thick, it must be animal hair. If medulla is very thin, cortex is large, it must be human hair. So hair sample, you are right. Then MLI, medico legal importance. So what is the medico legal importance of hair? Anybody? What is the medico legal importance of hair sample in forensic medicine, guy? Yes, come on. Basavaraja Kumbara, very good. Basavaraja Kumbara, he answered, sir, it is very important in DNA analysis. Very good. DNA. So one hair root at the crime scene. One hair root at the crime scene can help you to identify accused or the offender. Hair root, remember, it is not the hair. Hair root is important. As you know, DNA, VNTR, variable number tandem repeats, it is very specific to a particular person. So DNA analysis can be done with one hair root. That is the medico legal importance. Very good. Any other? Identification of person, nothing but DNA. DNA matlab identification of the person. Okay. Any other? Come on, guys. Any other importance of hair? Come on, guys. You need to answer. You need to interact with me in the class. So one is DNA, I said. Second thing, in case of rape, you forgot, right? Rape, bestiality, sodomy, it can be a trace evidence, right? So rape, again the hair sample, the present at the cloth or the body of the victim can be a trace evidence, so that can help the investigator to identify the accused and also to get the relationship. That is race, okay, up to some extent race, fine. Foreign body, okay, fine, yes. Then one more importance, I think, burn injury, right? Burn and scald, burn and scald. Burn injury caused by moist heat, burn injury can be caused by dry heat. So remember, when injury caused by moist heat, that is known as scald. In scald, singeing of the hair is present only in the burn injury, especially dry heat injury, not in case of moist heat or the scald. So this is what one more importance. One more importance is there. I am giving you the clue, guys. It is related to toxicology. So hair sample examination very important in toxicology. In certain poisoning, I am giving you clue, guys. In certain poisoning, like example, Napoleon Bonaparte death. Napoleon Bonaparte was a very famous king. He died due to some poisoning. His hair and nail were preserved and they were examined after so many years, and they came to know very high amount of some poisons in it. What is that sample? Anybody can answer? Very good, arsenic. Very good. So it is heavy metal. Heavy metal. Good. So Napoleon Bonaparte died due to arsenic poisoning. So it is said it is probably an homicidal poisoning, or it can be an accidental poisoning of arsenic also. We don't know exactly, but he died due to stomach cancer as a result of arsenic poisoning. Okay. Yes. So all of you understood. So hair sample. So again, animal or human. In animal, medulla is very thick, medullary index is more than 0.5. In human, medulla is very thin, medullary index is less than that. So medical legal importance, one is the DNA, rape, bestiality, sodomy, burn and scald, and heavy metals. So if you know this, more than sufficient. This can be a 3 marks question also in your exam. Okay, lead, okay, heavy metal, fine. Okay, next, look at this now. Now all of you let me know what is the difference between human hair and animal hair. One word answer. One word answer, guys. One word answer. Come on guys. One word answer of this. Human hair and animal hair. How to differentiate between animal hair and human hair? Anyone? Medulla. Very good. So medulla is very thick, medullary index. Okay. So cortex, medulla is thin in humans and it is thick in case of animal hair. Very good. Good answer. Good. Yes. It's very interesting picture. Then look at this. Now look at this bone injury and identify whether it is caused by dry heat or moist heat. Dry heat or moist heat. Look at the hair. So hair sample, here they are intact hair, no singeing is there. Yes guys, intact hair, no singeing of the hair. You can see the marks of the trickling, the marks of the flow of the hot liquid there. So what is this, guys? So what is this? So this is scald or dry heat. So this is moist heat. Very good. So this is the moist heat injury. Moist heat injury. Good. Also known as scald. Scald. Good. Good. So this just to explain the importance of hair sample. Fine. Then in exam the question can be asked about the seminal stain. Now this is the picture, a photograph can be given, identify the stain given below and the medical legal importance. So what we can see here, yellow needle shaped crystals. So, yellow needle shaped crystals are there, you can see here. So, what is the test and what is this sample? What is the sample? So, this stain was found in a case of sexual assault. Okay, I am giving you clue, sexual assault. So, a case of sexual assault. So, trace evidence is collected. So, the probably a seminal stain. So, seminal stain particular test is conducted. On particular test, so yellow needle shaped crystals are found. What is the probable test that is done and what is the medico-legal importance of seminal stain? Yes, this is the Sumana Day. So, good answer, very good. So, this is your Barberio test. Excellent answer. So, Barberio test. So, Barberio test. So, because of the spermine picrate crystals. So, we use picric acid in Barberio test. Picric acid combines with the spermine. So, that is present in the seminal sample. It forms yellow needle shaped crystals. Barberio test. Sometime they can ask you about Florence test also. Florence. So, what is the finding in Florence test? What is the finding in Florence test? Sumana De, batao. What is the finding in Florence test? Florence test is also done in case of seminal stain. Okay, and we use iodide solution in this Florence. Okay, we use potassium iodide solution. So, in Florence it is dark brown. So, dark brown rhombic crystals. Okay, rhombic crystals. Rhombic crystals. So, this can be your examination question. Then question can be asked about blood stain also. Blood stain. What are the tests for blood stain? Confirmatory test. What are the crystal test in blood stain? Anyone? Blood stain, what are the crystal test? The hemoglobin that combines with the reagent, it forms crystals. Hemochromogen crystals or hemine crystals. What are the named test of blood stain? Very frequently asked in forensics part of. Yes, Tickman and Takayama, very good. So, good answer, very good. Tickman and Takayama. Takayama. And Tickman test. Tickman test. Remember is Takayama. I remember Mama. Takayama, Mama. Pink feathery crystals. Tickman, brown rhombic crystals. So, very commonly asked in the exam. So, try to understand. For seminal stain, we use multiple tests. Barberio, Florence, acid phosphatase, okay, Walker test and all. Blood stain confirmatory we use Takayama test and Tickman test. Okay. Yes. So, what is the test done here? So, what is the test done here? Basuraj Kumbar and others. What is the test visible over the slide? Dark brown rhombic crystal, a case of sexual assault, a case of rape or sodomy. So, dark brown rhombic crystals are found during microscopic examination. So, when it combines with potassium iodide, what is this? Is it Tickman or Florence? So, it is the Florence test. So, Florence test is done for the seminal stain. Okay, fine. Next photo. Identify the weapon. What are the injuries caused by this? So, what are the injuries caused by this? Yes, come on guys, what it is? Can we answer this? So, one from the weapon. So, weapon can be iron rod, it can be a bat in exam, or it can be cycle chain, it can be knife, it can be dagger, anything that can be asked. Very simple only, you can answer in exam, no problem. So, what is this basically? Yes, this is the rope, hai na? Rope, nylon rope. So rope. So what is the medical legal importance? So MLI. So MLI. So one, it causes abrasion. So abrasion, bruise and contusion, laceration also. Second, it is also used in case of hanging, है hanging. If you write this, more than sufficient. Pattern abrasion, very good. Pattern abrasion, fine. Some student answers are pattern abrasion. So pattern abrasion. So Basaraj Kumbar answers are pattern abrasion. Good, pattern abrasion. So that is fine. Good answer. Good, many answer. That is fine. Yes. Okay. This is about the weapon. That is the okay. Next. Identify the weapon. What are the injuries caused by this? Probably a case of murder, and you can see the blood stains here, there, and you can see the corpus delicti here. Corpus delicti. So corpus delicti means essence of crime. Essence of crime. Essence of crime. So there is a weapon, that is, you can see here, there is a weapon. There is also blood stain here. Blood stain here. So what is this? So this is actually, yes, so Tuhi Mitra sir, this is basically hammer. Very good. So this is the hammer. Hammer. The hammer which causes depressed fracture. So depressed fracture. Very good. So hammer, heavy weapon having small striking surface. So hammer that leads to a depressed fracture, also known as signature fracture. So here the question can be asked about types of skull fracture: linear fracture, hinge fracture, okay, then ring fracture, hinge fracture, depressed fracture, pond fracture. So anything that can be asked, types of skull fractures. What is the most common skull fracture? Anyone? What is the most common skull fracture? Most common skull fracture. Heavy blunt weapon. Very good. So heavy blunt weapon. So that is a hammer. You are right. Not me. Very good. So it causes signature fracture. By looking at the fracture, you can identify the weapon that is used. Good. My question: what is the most common skull fracture in forensic medicine? Most common skull fracture. Very good. Sumana, the most common fracture is linear fracture. Linear fracture commonly associated with EDH, extradural hemorrhage. Extradural hemorrhage. Good answer. Good. So this is how the question can be asked. So rope can be asked. Hammer can be given in exam. Okay, fine. So next one very important question from firearm. One question will be there from firearm. So identify the below specimen or below particle. Mention two differences between entry exit wound. So this is typical forensic medicine. Typical of forensic medicine. Yes, what is this? Anyone? Anyone? Come on, guys. Come on, come on. Okay. Let's see who is going to answer this. If you answer, I am going to write your name on the slide. Okay. Just to encourage you to answer. Okay. Okay. Deepika Das, cartridge. Sumana De, bullet cartridge. Not me, cartridge of shotgun. So very good. So this is your shotgun cartridge. Shotgun cartridge. Very good. Shotgun cartridge. Okay. So it is not the bullet cartridge. Bullet cartridge different. It looks different. Okay. So this is actually base. Okay. You can also see the wad and a plastic wad here. So when you see wad, it must be shotgun cartridge. Shotgun is a smooth bore weapon. Okay. Who answered? So the answer by given by not me. Very good. Not me. What is your name? Not me. What is your real name? Good, he answered. Two differences between entry exit wound. Entry exit wound. So entry, I think you can write 2 points. So entry wound usually smaller, right? So what is entry? It is usually smaller. Exit wound is larger. Entry wound that shows blackening, है ना? So when you see blackening, it must be entry wound. So when you see blackening, tattooing, abrasion collar, grease collar, inner table beveling of the skull, it must be entry wound, guys. Difference between entry wound and exit wound, very commonly asked 3 marks question. Very commonly asked 5 marks question. Okay. So what are the features of entry wound? Abrasion collar present, grease collar present, smaller in size, blackening is present, tattooing is present, inner table beveling is present, singeing of hair is present. You need to mention some 6 or 7 points in the exam that we discussed in BW classes. Okay. Yes, good. Hari, very good, Hari. Very good. Basoraj Kumbar also answered fine. Entry wound has inverted edge, but okay, averted. All features of gunshot entry wound absent in exit wound. Okay, fine, fine. Sumana, they all answered. Is the Hari and I answered this question. Okay, Hari, very good. Chalo, next question. Identify the snake given. So, sometime wet specimen can be given, either snake or liver laceration, extradural hemorrhage, subdural hemorrhage, brain laceration, spleen laceration. So, what is the snake specimen, that is? What is the medico-legal importance of this? So, what you can see here, brown color spots. You can see the brown spots are there. So, brown spots are there and triangular head. Okay, triangular head. So, what is this? Okay, triangular head and brown spots. Yes, let's see who is going to answer this. Yes, very good. So, this is when I talk about triangular head, constricted neck, brown black color spots over the body, pointed tail. Okay, fangs are present, fangs are curved, long, hemotoxic. It must be your Russell's viper or viper it is. So, basically it is Russell's viper. Russell's viper. Russell's viper, it's venomous basically. Good. So, the answer given by Basoraj. Okay. So, Basoraj Kumbar. So, Basoraj Kumbar from which college? Basoraj Kumbar from the college name Basoraj Kumbara. Okay, good. It is a viper snake, correct answer. Viper, that is fine. And what is the medico-legal importance? So, as you know, medico-legal importance, the most common is the accidental. So, most common snake bite is accidental only. Okay. Second, it can be homicidal. Rarely it can be a suicidal. Like example, Cleopatra, she died due to suicidal snake bite. So, accidental, suicidal, homicidal. And the question can be asked, what type of toxicity, hemotoxicity, what is the bedside investigation, that is 20 minutes of whole blood clotting test. So, what are the features of neurotoxic snake, what are the features of cobra bite, what are the features of common crate bite, what is the treatment, what is the dosage of venom, anti-venom. So, anything that can, differences between poisonous snake, non-poisonous snake, so anything can be asked. Okay, good, good. Okay, MLI, Deepika Das, very good. So, very good, all answering, that is fine. So, good from Karnataka, Basoraj, fine. Now, anybody, now look at this. So, this is common cobra, okay, common cobra. What is the most common or the most earliest finding in case of common cobra bite? So, earliest manifestation. Yes, now let's see who is going to answer. Earliest manifestation. Come on, guys. Earliest manifestation. Good, very good. Sumana De. So Sumana De is first to answer. Sumana, very good. So she answered, sir, it is the doses. So doses 15 milligram is the fetal dosage. Fetal dosage. Okay, and it has a spectacle, hood, and all. I know we discussed in our classes. Okay, fine. So seventh question from the toxicology, proper toxicology, especially seeds and all can be asked. So identify the sometime plant also can be given in your forensic spotter. So we usually keep plants like example castor plant, datura plant, oleander plant, other plants also. Usually these three plants are common. Now there is a plant which is having a fruit, and the fruit is having spiny projections. So identify the poisonous plant and what is the MLI? What is the MLI? Okay, okay, good, good. Anybody can answer this? Good, good. Come on, guys. Thorn apple, है ना? It is known as thorn apple. Thorn apple. And so this is your datura. Datura fasciculosa. So datura plant. So datura plant. So datura seeds, they are brown color seeds, double edged, kidney shaped. The fatal dosage is 100 seeds. They consist of hyoscine, hyoscyamine, and traces of atropine. It causes 9D manifestations. Treatment is physostigmine. So here, what is the medico-legal importance? Medico-legal importance of datura poisoning. Yes, Sumana De first to answer, and Deepika Das, very good. It is a railway poison, roadside poison. So it is a railway poison or road poison. Road poison. Okay. So this datura seeds, resemble like chili seeds. So these datura seeds can be mixed with the food, especially sambar. Sambar. So chili seeds are there. No, it can be mixed with the chili seeds, and it causes delirium, known as muttering delirium. So this can give some opportunity for the robbers for robbery as well as some other crimes basically. So datura is a road poison. So it also used along with other agents as a cattle poison, uh, and it can lead to accidental poisoning in children. Okay, so this you need to write in the exam. Sometimes these datura seeds are mixed with the alcohol just to increase the effect of alcohol. Sometimes it is mixed with the other agents of drug abuse. Okay, so there are many importance. Datura, it causes delirium. Okay, good. Accidental poisoning basically. Very good, very good. So this is about the question number 7. So datura plant, road poison. Fine. Now photograph. There will be one photograph, probably rigor mortis, postmortem staining, decomposition, mummification, adipose formation, or algar mortis instrument, or eye findings, Kevorkian sign. So this is one typical example, so which we give in our college. Identify the photograph. So here is the photograph, photograph showing back of the dead body, showing cherry red discoloration. So cherry red discoloration. Okay, cherry red. So what is the answer, guys? So the finding is postmortem staining. Postmortem staining. Postmortem staining. Okay, good. Liver mortis. Liver mortis, fine. What is the poisoning? What is the poisoning, guys? Yes, Sumana De, it is the carbon monoxide poisoning. Excellent answer. Carbon monoxide poisoning. So it causes histotoxic anoxia and death. It inhibits complex 4 of electron transport chain. Complex 4. So what is the medico-legal importance of postmortem staining? Anyone? So what is the medico-legal importance of postmortem staining? What is the medico-legal importance of postmortem staining? Anyone? Anyone, guys? Anyone? Come on, try. Yes, Sumana Dev, very good, sir. It shows position of the body. Very good. Position of dead body. So when liver mortis is there on the back of the body, the probable position in which the body kept is the supine position. Front of the body, probably it is the prone position. Hai na? So this liver mortis is absent in case of extreme degree of anemia or drowning where there is a frequent flotation of the body. Okay, position you can identify. Good. Second, time since death. Excellent answer. Time since death. So by looking at the postmortem staining, you can identify time since death. So say example, it is fixed. Okay, fixed. Anybody? Postmortem staining is fixed. So I said postmortem staining is fixed. So during autopsy examination, so while entering into the autopsy room, during examination of the dead body, I found postmortem staining is fixed. There is no color change on pressure. That means it is fixed. Anybody? What would be the time since death? What would be the time since death when postmortem staining is fixed? Come on, guys. Very good. Deepika Das, 6 to 12 hours. Excellent answer. 6 to 12 hours. So the answer given by Deepika Das. Deepika, very good. Deepika, very good. She answered. Very nice. 6 to 12 hours. So TSD, time since death. Then you can also identify poisoning by looking at the color. By looking at the color of the postmortem staining, you can identify the poisoning also. Like example, cherry red color, carbon monoxide, brick red color, cyanide poisoning, opium poisoning, black color. Okay. So brown color or yellow color in case of yellow phosphorus poisoning. So what is the medical legal importance of postmortem staining? Sir, one is position of the dead body can be identified, time since death can be identified or can be established, poisoning also can be detected. Okay, this is how you need to answer. Yes, have you understood this question, guys? Understood this question? Question number 8. Say yes or no? Yes or no? Yes or no, guys? Come on. Okay. Next one, very important specimen is the fetus can be given. Length of the fetus is 25 centimeter. What is the gestational age of fetus? What do you mean by viability? This is how we frame the question in forensic spotters. Simple. A fetus photo can be given, or sometimes wet specimen can be given. So the length of the fetus is around 25 centimeter. Okay, 25 centimeter. So what is the age? So age is equal to square root of length. Square root of length. Or age is equal to length divided by 5. Length divided by 5. So this is known as rule of Hussey. Rule of Hussey. Rule of Hussey. Right? Rule of Hussey. So that means it is 5 months. 5 months is the correct answer. So square root of 25 is equal to 5. That means 5 months. So what do you mean by viability? Viability means 7 months of age. Okay, 7 months is the age of viability. So in India it is around 7 months, 28 weeks. Okay, 28 weeks. Rule of Hussey. Medboy, very good. Medboy. Medboy can answer. Anybody can answer. What is the ossification center that appears at 7 months? I'll repeat again. What is the ossification center that appears at 7 months of intrauterine life? Anyone? Can you answer? Anyone? Medboy and others? Come on, guys. Medboy, Basuraj, Sumana De, Deepika Das. Tell me. What is the center appears at 7 months? 9 months, it is the lower end of femur. Okay. 10 months, upper end of tibia. My question is at 7 months. 7 months. Talus, very good. So, Basuraj, excellent answer. Answer is talus. Good. And the last question. Identify the seeds and the medico-legal importance. So, the seeds are round seeds are there, concavo convex, central depression is there, sometimes hairs can be present, so they looks like banana chips. Okay, so what is this seeds? What are these seeds? Come on, guys, what are these seeds? What are these seeds? Yes, so these seeds are Nux vomica seeds. Very good. So these are Nux vomica seeds. So what they consist of? Strychnine. So basically a spinal poison. It resembles like tetanus. So what is the fatal dosage? Anybody? What is the fatal dosage? So medico-legal importance. So it can lead to accidental poisoning and death. Sometimes this Nux vomica powder or strychnine powder is mixed with the drug of abuse. It can lead to sudden death in people, those who are taking this drug intravenously, that is known as mainlining. It resembles like tetanus. Okay, one crush seed, Medboy. Okay, Strychnine Nux vomica. This is one crush seed. One crush seed. So treatment is short-acting barbiturate. What is the treatment? Short-acting barbiturate, and cause of death is respiratory paralysis. So it is a post-synaptic poison. It acts on the spinal cord. It inhibits the action of glycine. That's why there is overactivity of glutamate. Causes rhizus sardonicus, opisthotonus, pleurostotonus, amprosthotonus, respiratory paralysis and death. So, but consciousness is retained till the end. So, coma is not the peculiar feature of this strychnine poisoning. There will be conscious seizure in case of strychnine poisoning. So, I'll repeat again, these seeds are round, concavo convex, central depression present, hairs are present. So, they are seeds of Nux vomica, they have bitter taste. So, they are spinal poison. Fatal dosage is one seed and the fatal period is around 24 hours. Usually signs and symptom occurs after the gastric emptying, maybe 5 to 6 hours. Treatment is short acting barbiturate, accidental poisoning. So it can be homicidal poison also. It mixed with alcohol. Okay, sometime this powder is mixed with the alcohol given to the victim. So the person dies because of the conscious seizure, respiratory paralysis and death. Okay, so this is about the 10 important spotters we discussed today. I'll repeat again what are important spotters can be asked in your exam. So the question can be from hair sample, seminal sample, other biological fluid, blood, photograph, poisons, histopathology, firearm cartridge and weapons. So the first spotter we discussed today is the hair. So here and the medico legal importance. So and we discussed about blood stain and the seminal stain. Then we discussed about weapon. The one weapon is, that is the rope. Second, that is the hammer. Then very commonly asked is the cartridge, either shotgun cartridge or bullet cartridge. So the question can be asked, write the diagram of the shotgun cartridge. You need to write about the base, primer, gunpowder, lead balls, wad and all in exam. Differences between entry and exit wound you must know in detail. Then the snake, very commonly asked, Russell's viper, Saskell viper, common crate and common cobra and treatment, hemotoxic or myotoxic or neurotoxic. So then comes with the poisonous plants, either it can be oleander, yellow oleander, pink oleander, it can be Ricinus communis castor plant, it can be datura plant. So what is the medico legal importance? Then the postmortem staining, rigor mortis, decomposition, mummification can be asked. Then one usual question is the wet specimen fetus given, rule of assay. And the last one, that is about the seeds. It can be chili seeds, datura seeds, castor seeds, croton tiglium seeds, semicarpus anacardium, anything that can be asked from toxicology. So okay, so this completes your today's session. So I hope you understood. So have you understood, guys, the proforma today overview? Understood this? Any doubt you can ask me from this? Yes. Medboy, Sumana De, any doubt? Any doubt? Deepika Das. So those who are following our lectures in YouTube and in Shushruta batch PW, it will be very easy to follow. Okay, we discussed everything in the app. So along with the autopsy findings, along with the photographs, images, everything, that is interactive session in Shushruta batch. So understood, Deepika, Sumana De, any doubt? So wish you all the best for your upcoming exam. So most of the students are having exam by next week, probably theory, and next to next week is the practical. Wish you all the best. Do very well in third year. Okay, so getting good mark in third year definitely give you some confidence. Okay, so anyway, marks are directly proportional to your knowledge as well. Okay. So that's it about the Farre series 1.0. So once again, thank you everybody. Wish you all the best. Do very well.